Hello everyone, this is Dr. John Makoff here. So today I want to talk about the sensory nervous system and how to rehab it. So the sensory nervous system is part of your regular nervous system that takes in information about pain, light touch, deep pressure, compression pressure, temperature, vibration, proprioception, which is movement ability and how you move in space, as well as form recognition, which is a unique sensory aspect of how you are able to view and recognize shapes, colors, forms, whether numbers, letters, can affect with reading, as well as shapes on the body or textures on the body, as in shadows, surgical equipment, different trauma equipment. So if someone was hit by something or fell on a stair, sometimes bringing that form recognition information into the body can help that injury heal more versus being a chronic injury. So there's a lot of different aspects of that sensory system. Now, to go about rehabilitating that type of thing, some of the issues you might have with a sensory system is pain, numbness, tingling, lack of sensation, lack of variety of type of sensation, are able to identify different temperatures and how to adapt to them. So there's a lot of different aspects of the sensory information for that we are able to rehab. That may seem like it hasn't been able to before, but has it the ability to, if we are allowing ourselves, or we have help getting our bodies to see in a different way of what needs to be healed. Through quantum neurology, one of the things they talk about is if your body can't see it, and see is not just through the eyes, but sense it, be aware of it, then your body can't heal it. So what we do with quantum neurology and functional sensory rehab and functional neurologic rehab is trying to get your body to see what it hasn't seen before, that got disconnected from what it was originally seeing before, and bring that awareness in to be able to allow the body to heal itself. If we give the body the tools to heal itself, very often it is able to, whether from the internal aspect or from the external aspect. So when we're doing sensory rehab, we first usually make sure all the brain nerves are online, which is, the nerves going to the eyes, the sense of smell, the facial expressions, tongue movement, and functionality, hearing, various sensations, shrugging, touching, all over this. And what we do is we check the body for whether, using some muscle testing, muscle testing on somebody else, is if that test inhibits the nervous system, or if nervous system is intact, or if the nervous system is over facilitated. So inhibition means it's almost like there's a disconnect. So the body will go weak when we test something that's inhibited. If it is normal, then we should feel a very locked muscle when we muscle test it, as well as when we challenge it to relax, it should be able to relax. When it's over facilitated, we should feel a very strong muscle when we challenge it, but also when we try to find a challenge to make it relax, it doesn't relax either. It's still active. So neither the inhibition or over facilitation are really great responses for a normal functioning nervous system. If all the brain nerves are intact and ready to go, we then start to challenge the sensory system. So with the sensory system, we have this little pinwheel to check on pain. So it doesn't mean it caused a lot of pain, but the sensory system is a very fine-tuned system. So as we do the little pinwheel over areas, whether there's some scar tissue, whether it's just regular tissue that has some lack of sensation, whether you consciously aware of it or it's in your subconscious, we challenge the muscle while we check the different areas for those issues. And we do that while we also have this little red light and infrared light stimulating the brain, and we challenge it under that stimulation to then see the response. We do that also for just light touch. We do that for using some tools for some deep pressure. We can do that for compression, so whether we just grab really tightly around, or sometimes we get a belt and like pull it around areas to see it can handle compression. We do it for temperature, so whether with some I have some hot packs, cold packs, and test the system, because if you know, if you've had injuries and you a lot of times use cold packs, sometimes you will use a heating pad as well, but if your body doesn't respond and interpret that temperature correctly, you might do more harm than good. So this is challenging the nervous system in that way. We use, this is like a Resimax that I use for vibration. I also have at the office an ArthroStim, but we check vibration and see how the body responds to that vibration. Now, if you've stepped off a curb before and had that impact because you weren't expecting the depth of the curb or the suddenness, that can create a little trauma. And if that trauma affects, excuse me, if the trauma affects that nervous system so that it's not aware or can't interpret that vibration afterwards in that hip joint, in that knee or ankle, then it doesn't know how to handle the shock of each step it takes. So until we get the body to be aware of what vibration is and how to interpret that information, every step you take may be more and more impact. Over the days, over the months, over the years, that might start to wear down the joint because it's not adapting correctly to that sensation. And so you start to wear down the cartilage and wear down the joint, and that can cause some arthritic issues. So that's another thing. Another thing is form recognition. So whether we're sometimes challenging someone with their reading for numbers and letters and upside down and how to see, and retrain that until the nervous system has the integrity to handle that stimulus of those different forms. Or if someone's had surgery or even tattoos or whatever, we might use a light to shine like a box cutter representation of a scalpel, because when you're under anesthesia, you don't know what's going on, but your body does remember the injury and the type of tool, even though it can't connect to it. Or if there's a stair you fell on, or, and getting a shape similar so that that shadow starts to be recognized on the body of what may have occurred when it wasn't conscious, and that can start to reestablish an awareness in the body to help with that healing. Whether we also challenge during movements. So these are a variety of ways that we start to help with some chronic issues, chronic or just post-surgery rehab, or different aspects. And sometimes, we have to challenge and see if some of those things may be related to a nutritional issue, a chemical issue, an emotional, mental stressor issue. And if that comes up, we work through that as well. So hopefully that was informative. Hopefully that brought some light to a whole different way of addressing some issues that you may have. And if you have any questions or comments, please leave below. And thank you for joining.